So if I could introduce our first speaker. So Tim Dudgeon is speaking on behalf of Farmerados. Tim is a retired general practitioner who used to work in the agricultural community. So he's obviously dealt with a lot of mental health in the agricultural industry. And when he retired, he wanted to carry on working with the ag sector. So he's done qualified in mental health, first aid, and he's worked with Becky Wright of New Leaf, which a lot of you know in Somerset, and now trying to get things running in Devon. So if I could hand over to Tim.
Good evening. Thank you very much for letting me speak. Farmerados. So Farmerados sort of was launched in October 2020 by the Somerset Young Farmers in conjunction with Becky Wright from New Leaf. And they started a sort of what's called the first public living room at Sedgemoor Market. And they were given permission to change from the organisation Camerades, which is the parent organisation, but they were allowed to call it Farmerades, so it's specifically relating to the farming community. So what is a farmerado? A farmerado is halfway between a friend and a stranger on a farm. And in the pictures you see here, this is at Sedgemoor Market. The young farmers made the space look wonderful, and the public living room was born. Camerades was the movement was started by a man called Math Potts. If we could go to the next slide. Yeah, so that's Math Potts, and basically the simple act of being more human, to look after each other, was one of the really underlying philosophies behind it. And he felt that if we looked after each other, this could have a transformative effect on people, especially in people going through tough times. So it's based on the simple belief that having a people and purpose in your life is extremely important, especially when you're having a tough time. So what does look after each other mean? It means having someone alongside you in your moment of need, whether you know them or not. So it's about coming together to be supportive, with no expectations of fixing the problem, but just being there. And just being there can be extremely powerful. So it's sort of mutual aid. So it's not just one person giving aid to the other person. The person who's having a rough time can actually give aid to the person, the farmerado. So if we could go to the next slide, please. Right, it's this slide is it says, as you can see, it's okay to fail, and it's okay. We all have moments of weakness. We all have failed in certain aspects of our, maybe all sorts of aspects of our life, maybe work, maybe home, all sorts. And it's okay to fail, and that's an important concept to sort of get across to the farmer, that if he's going through a rough times, it's okay. It's you're there to help, but you're not there to moralize on him. There is a badge that the Camerades have, which says, "I'm a bit of a sometimes," and some of the Camerades wear that, and it seems to go down quite well. So, if we could go to the next slide, there we are. Just being alongside. It's quite easy when you see people having a rough time not to get involved and to walk away and turn your back on it, because they feel that they can't take on the responsibility. But Camerades don't do that. They have the power of lending a ear, acknowledging the person, being alongside them in that difficult moment. So for those people experiencing tough times, just being heard is enough. And that's why strangers can make great camarades. Um, and you may have experienced this sort of feeling or help yourself. Um, you don't have to look like the person you're alongside. You may look completely different, and that's again perfectly okay. So we learn from each other. If we could go to the next slide, please. Um, so you'll be mixing with people that don't look like you, or folk who have different life experiences. Often challenge it. Often those experiences challenge our thinking, broaden our minds, and make us less sort of judgmental or scared of each other. So accepting difference. Next slide. When times get tough, it's the first thing that really gets kicked into touch is having fun. So when we do something, set up a farmerade, a public living room, try and make it fun, and that will often have just taking people out of a poor situation, a bad, troubled situation, just lifting them out of it for a period of time can be very helpful. So we go to the next slide. Yes, we're quite likely we may not always agree with each other. So they may come from, have different sort of interests, which we don't maybe approve of, or whatever. And that's perfectly okay. It's all right to have differences, but if you do have differences, it's best not to fall out over those differences. So level up with each other and do it respectively, and agree to disagree. Next slide, please. Right, this one I think is quite important. If someone is struggling, try asking them to help you. So if you're talking to someone and you're maybe getting slightly stuck, it can be quite a good technique to ask the person um, their advice on something. I did this the other day when we were running Farmerado at Wiveliscombe, and the farmer was just about to harvest some maize, and I was talking about companion planting, and so companion planting in the maize. So when you harvest it, you don't get the runoff of the soil and everything as much as companion planted maize. So I wanted him to teach me. I've got some raised bed in the vegetable patch. How could I use companion planting in my own situation? And he was fascinating about it, and spent quite a lot of time. And he chaired up and talked quite openly about what I could do. And I was having trouble with cabbage white in brassicas, and he was telling me various plants that might help in the future. So that's a technique that you can use, where you're asking the person who is potentially there to be helped by you to turn it the other way around. And I think it's a good technique. There was a webinar earlier today, and one of the CEO of Farming Community Network was talking about the disconnection between the general public and farmers, and how we should really try and reconnect. And we sit down 3 times a day and eat our meals, but we don't think, where did this food come from? Or we may not. And if we do that and say, gosh, this has come from a farmer doing this, that, and the other. So it would be good, maybe in a farmerade situation, to use meals and things as a way of reconnecting with him and making him or her or the people you're talking to more connected with yourself. All right. If we go to the next slide, please. Right. These are various pictures. So let me think. Where are we? So these are the various Farmerado setups and Camerado setups in various situations. So as you can see, you can set it up in any way that you want. So there's a teepee. It can be in a room. It can be whatever, and it's just a space which you then turn into a friendly environment for people to come and sit down, maybe with a cup of coffee, maybe with a cake, and talk. Right, next slide, please. Again, this is another open living room, and you can get from Camerades, they will send you if you wanted to set up your own open living room at an event, say a market or wherever, then you can get a thing and they will give you some buntings, they will give you some leaflets, they will give you some mugs, they will give you some postcards, they will give you things for, as you can see, look out for each other. They give you some postcards and things to write down in an experience. So all this is in a pack which comes free from the Camerades thing. It does say Camerades at the moment as opposed to Farmerades because we haven't got any money at the moment to change that. So next slide, please. Right, this is with Liscombe. That's me on the left, as a young farmer on the right, and that is someone who just sat down and was talking to us. That was at, as I say, with Liscombe at a fair. It wasn't a so it was in a rural setting, but the majority of people probably weren't actually farmers. Next slide. Right, this is Becky Wright, and this is at a dairy show, and she's with Katie and Trudy. So simple. They just had a bit of bunting. They had their t-shirts or sweatshirts, whatever you call them, and then various things that come in the box from Camerades. And if you can see at the front, there is also on the front right on that table, there is the what we call a Z card, zip card, which has been produced by the Somerset Mental Health and Agricultural Group. And that is a really good card. And I've sent some to Nikki, and she's got them. And it tells you about contact numbers that you can give. So it gives you contact numbers for Farming Community Network, Rabbi, Samaritans, and what to do in an emergency. And this card has been sponsored by the NFU and various other things. And it gives you a list of symptoms that people undergoing stress can be suffering from. Those cards, I think, are really useful, and they can be handed out and given to farmers, given to people, and so they know that people are there. There are organisations around who can help. Last slide. This is Becky's favorite visitor with his Camerado mug. So we're going to make some Farmerado mugs, but we haven't got them as yet. So we don't put up signs about mental health because that people we feel are less likely to come in if you have a big sign up saying mental health. They won't walk across the front door. So keep it warm, keep it friendly. Have your Z cards around and set them up and enjoy yourselves. I've only run 2 or 3 of them now, or been to 2 or 3 of them. First one I wasn't so sure about it, but as one developed a bit of confidence oneself, it became fun, and people did want to engage, and I think we were of use. That's all. Thank you very much.
Oh, thank you very much, Tim. That's really interesting. I think we had an issue with one of the slides. I don't think we could some couldn't quite see everything. There's only black with a white circle. I think that was when you were saying about what to look out for and symptoms, but I was going to ask how we could sort of get access to any of the material, to help promote.
Well, what I'll do is I'll get in touch with Becky from New Leaf, and then if I send you or Nikki the contact details of where you can access your Camerado boxes, and then you could send that out to your listeners, and if we got enough Z cards, we can give you some more of those, because I think they're very useful to have when you do set up your open space.
Oh, that's brilliant. Thank you. So I think Susan was having trouble seeing it. So if anyone just pop a message in and we can pick up all the messages and get sort of stuff forwarded on to you. So I was just going through any questions. So Sarah Kyle, so she says that she's currently doing a small-scale research project for an MSc examining resilience and wellbeing through social connectedness in farming communities. So that's obviously really relevant for Sarah. And I hope if that's all right with you, Tim, this is a really good way that we can put people in touch with each other. And obviously, but do you have any plans to sort of take the living rooms to sort of shows next year or anything?
Yes, I mean we have got some plans that we want to sort of join Devon and Somerset together. So at the moment it's a sort of Somerset mental health, but what we want to do is join forces with Somerset, and then we would like to go out to various markets and Devon Country and shows. So if you go to something like the Honiton show or various other Oakhampton show, all those sort of events, and try and then get people to set them up, young farmers, different sort of people. I mean, there was in the webinar this afternoon at lunchtime today, it came across quite strongly that farmers really like to be helped by fellow farmers as opposed to others from outside. So I think we need to take it to farming settings where the farming community will be there. Try and get them run by young farmers or people connected to agriculture. So we haven't gotten any specific dates as yet, but the answer is certainly to roll it out at various events and sites across the county over the course of the next year.
Oh, that's perfect. I think, sorry, I jumped in, but Robin, a guest, has just said they were going to ask that as well about getting out to the shows. So I know certainly when we did Devon County last year, that was a really good popular. So
I think we'll try and go to the sort of some of the peripheral ones and smaller ones. So and some of them are more agricultural than others. If you get my meaning.
Yes, I do. Does anyone else have any more questions for Tim? As I say, if we get questions throughout the night, Tim, we can always send them on to you.
I can't stay to the end because I've got another thing I've got to do. So but if other subsequent questions do come, if you keep them and email me them, I'll answer them, and then the answers can be sent out to people.
Oh, that's perfect. Thank you very much, Tim. That's really interesting. Thank you.
Okay, thank you so much.
Thank you. Okay, so our second presentation tonight is from Kim Wright of Accept Service. Kim did an introduction back at our first webinar in 2020 into Accept, so she's kindly come back to give us a presentation tonight. Kim is the clinical lead in accessing evidence-based psychological therapies. I hope I got that right. But if I hand over to Kim, thank you. Oh, you've gone on mute.
Yes. Hello, nice to be here. So my name is Kim Wright. I'm from the Accept Clinic, which stands for Accessing Evidence-Based Psychological Therapies. Excuse me if you can hear piano music in the background. My son's like having a lesson at the moment, so unfortunately it might be drifting around in the background, or perhaps fortunately, if you like that sort of thing. We're based at the University of Exeter, and can we have the next slide, please? So we're an NHS funded service for adults in Devon. We've been running since 2008. We're based at the University of Exeter, but we're actually serving the local community. So we're quite unusual because we're in a university, but we're NHS funded and operating as a regular NHS service. We're a psychological therapy service. And we do two things mainly. We offer something called mindfulness-based cognitive therapy, which I'm going to talk about today. And we also offer new treatment approaches for depression and related conditions. So we're half a research clinic and we're half a regular psychological therapy service specialising in mindfulness-based approaches. And it's that part I'm going to talk about today. Can we have the next slide, please? So we offer therapy across the whole of Devon now. We've got satellite hubs in East Devon, Tiverton and North Devon when we run face-to-face groups, but our main hub is at the University of Exeter on the Streatham campus. Currently, because of COVID, all our group therapy is online, and it's still online because of the particular challenges of, bringing a group of people together when there are quite a lot of cases around. But we're hoping to return to some face-to-face groups next year. And what we're probably going to run is offer a sort of mixed economy of face-to-face groups and online groups, because we found that actually some people prefer the online groups because it's so much easier to access. It's important to say, just to understand a bit where we fit in terms of local NHS services, you might be aware of a service called TalkWorks, which is primary care psychological therapies for people with depression and anxiety, and that's open to the general population. So we are not a replacement for TalkWorks, we work alongside them. And they tend to offer a lot of individual therapies, cognitive behavioural therapy and some others, and they also offer some group-based treatments. We're a much smaller service and we're focusing on mindfulness-based group work, and we work in collaboration with TalkWorks. So if you are somebody, or you know somebody who's experiencing depression in the local area in Devon, they can self-refer to TalkWorks or go to TalkWorks via their GP. But we offer something very specific for people with depression that I'm going to talk about now. Could I have the next slide, please? So we offer mindfulness-based cognitive therapy. So this is a therapy that's been around for a little while. It's a fusion of mindfulness-based approaches and cognitive behavioural therapy. And it was developed to help people who had depression in the past, are currently feeling pretty well, but want to reduce the chance they're going to become depressed again in the future. And typically we've been thinking of people maybe of having at least a couple of episodes of depression in the past. And you don't necessarily have to feel completely 100% to do MBCT. Many of the people we see have some remaining depressive symptoms, like maybe some sleep disturbance, a little bit of low mood, but they would say, I'm not in the grip of a depressive episode. I'm not really strongly depressed. I've come out of it, things are okay or mostly okay. So what MBCT involves is you learn a mindful awareness-based approach, It includes information about depression and cognitive therapy-based exercises about the impact of thoughts on feelings. And it's really about sitting in a group and learning some practices, some kind of meditation type practices to help everyone become more aware of what's going on inside and kind of step back a little bit from difficult thoughts and painful thoughts and feelings, not run away from them, but step back a little bit, see them from what they are and be able to sit with them and, you know, kind of without getting kind of overly distressed and caught up in them. I'm sure many people will be able to relate to that sense of, you know, sometimes your thoughts can run away with you, you can get lost in worrying or upsetting thoughts, and before you know it, you know, an hour's passed and your mind's gone all over the place. MBCT helps us sort of disengage from that process a bit and, you know, be able to have those thoughts without kind of getting on that train and powering off out of the station into a much kind of darker place. MBCT, mindfulness-based cognitive therapy, has a good evidence base. It's been the subject of quite a lot of clinical trials across the world, and as a result, it's recommended by the National Institute of Health and Clinical Excellence for reducing risk of relapse in depression. Can we have the next slide, please? So what does it involve? If you attend one of our groups, you'll first of all have an individual one-to-one orientation meeting with the therapist to make sure that MBCT is right for you. After that, if it is right for you, you can join a group. The groups are weekly and there's 8 weeks of sessions. The sessions last for about 1 3/4 hours with a break in the middle. It's quite experiential, as in there's practice in it. You know, you come along in comfortable clothes because you might be doing some sitting or lying and moving about as you do the meditation practices. So there is some talking in it, but there's a lot of doing in it and practicing the exercises. We run about 9 courses per year. We try to do them at different times of the day. And there'll also be home practice of what you learn. So you'll be set some homework to do to sort of consolidate what you've learned. But don't worry, it's not, you know, it's not the sort of horrible homework that most of us remember from school. It's really just setting aside time to do some meditation practice to get into the habit of it and get better at it. And then once you finish, we're quite unusual in the UK in that we have monthly reunion sessions where anyone who's ever attended one of our groups can come back and practice their mindfulness skills. So it's a kind of open to anyone who's ever attended, and it's a way to keep in touch with those ideas and keep practicing, because the idea with mindfulness is that you try to kind of keep it going. It's almost like regular exercise. Okay, next slide, please. So I don't know if this will work, but I've got a little demonstration. Will it work? Something's happening. Or if I can be allowed just to share my screen for a moment, I can play it. Would that be okay? Because I've got it up on the internet.
Yeah, that should be okay.
Do that.
Sam, can you see if?
Yeah, so hopefully I've shared my screen. Can you see that?
That's great. I can see it if everyone can.
So I hope I'll play it, and maybe if you could let me know whether you can hear the sound or not.
Yeah.
Can you hear sound?
Nothing at the moment.
Okay. Let me just see if there's, I don't know if it's, I might not have permission for, oh, here we go. No, I can make it happen. Okay, let's try again. Okay.
Everybody, welcome. I'm just arriving here in this space to share the practice in MBCT today. So just as we would if we were arriving in a room together, just inviting us all just to take a look around the screen and just say hello. So just looking around the screen, having a smile, a silent greeting to each other just as we arrive for our practice today. Welcome. Yeah, hi as well. So our session today is called Gathering the Scattered Mind. So we're so often in our busy lives lost in thought and The mind's working away in the background. It's solving our to-do list, or it's moving up into the future with planning, unfinished tasks. And today, in today's session, we're beginning to explore how we can return and reconnect with mindful presence in the moment.
So I'm just going to pause it and I'm going to skip forward a little bit to so this is Jerry, one of our other therapists. He's just finishing a practice and then he's just getting some thoughts from the group. So I'm just going to just show you a little bit of that.
Just noticing no sounds and silence. What's here in this moment? And then gently gathering in the spotlight of attention from sounds and the room, and bringing the attention into the body and noticing where the body makes contact with the surface that it is sat on. So noticing that point of contact of the body sitting on a surface. And then gently moving the attention down through the legs and into the feet, and noticing the left foot making contact with the ground, and noticing the right foot making contact with the ground. And as we bring this breathing space to an end, gently opening the eyes if they're closed, or just bringing the gaze back to the screen if the eyes are closed or in a half gaze. So that's a 3-minute breathing space. It may have been just a little bit longer than that, but this is a practice, is a mini meditation that we can bring to daily life. And we're just going to move to what we call the inquiry. And all that means is simply for people just to reflect on what they noticed during that practice, what was noticed. That's all, just noticing what came up for people during that practice. So I'm going to ask you to just reflect on that, what happened, what people noticed during the practice, and just unmute if you'd like just to share a few words about what you noticed during that practice.
I noticed I was holding my breath once we got to the middle bit. And that I just noticed I was holding it in.
Yeah, good noticing, Sarah. So you just noticed that when we came to the attention on the breath, it was being held. Yeah. Yeah. Were you able to breathe out from that holding of the breath?
Yes. Yeah.
Yeah. Good noticing. Thanks, Sarah.
Okay, I'm going to unshare my screen now, and I don't know whether you can share the original presentation again, if that's okay. So I just wanted to show you that, because often people say, well, you know, what on earth is this like? And particularly online, how can you do this sort of group online? So I wanted to give a little idea of what that looked like. Can we have the next slide, please? So how can people access our groups? So you can either ask your GP to refer you to us, or you can refer yourself directly. You can contact us to get hold of the referral form. We'll then let you know, just from looking at the referral form, whether we think MBCT will be a fit for you, and then after that arrange which course you'd like to book onto, and then you have your individual orientation with the therapist and so on. The TalkWorks service also refers people to us. So if they have people come through, you know, if you go to TalkWorks for help with depression and actually it turns out you're feeling fairly well, they can refer you over to us, or at the end of seeing TalkWorks for depression, if you're feeling better, they'll often refer you over, if you want that, refer you over to us for mindfulness-based cognitive therapy, because that kind of works quite well, one after the other. And it's free, it's on the NHS. Okay, next slide, please. So to find out more, see our website, which is here, or you can just search, if you don't have a way of writing that down, noting that down, just search for Accept Clinic Exeter and we'll come up. You can email us at acceptclinic@nhs.net, or you can leave us a message on the phone on this phone number 01392 723493. Okay, thank you very much.
Thank you very much, Kim. I did notice that chap. He's got a very, very relaxing voice when he was doing mini meditation and the breathing space. That would be fantastic. We've just got a couple of questions or a couple of points. Robin has asked, can we have the same service in Somerset, please?
Well, that would be, I would love this to be available across the country, and there are efforts at the moment. There's big training efforts over the last few years to train up mindfulness therapists across mental health services across the country. We don't have any control, unfortunately, over what goes on in Somerset, but it should be coming that way. And if you're interested in it, you could contact the local, I don't know what it's called there, but it's nationally, it's called the IAPT service, Improving Access to Psychological Therapies. Our one in Devon is called TalkWorks. In Somerset, it'll be called something different, but the Somerset IAPT service, they may already be offering mindfulness-based groups.
Oh, that's great. And it's also asked, are you looking at EMDR, and what is your feeling on the use of it for PTSD treatment?
So we don't offer EMDR because we're primarily a service for people with depression or bipolar disorder. But I believe that it can be available in IAPT services. I think it's offered in TalkWorks. It is an evidence-based approach, and it's in the NICE guidelines for the treatment of post-traumatic stress disorder.
Okay. And Robin's also said the BCPS at the Mineral Hospital, now the RUH, use a similar technique in their pain management programs, and it's extremely effective.
Yeah. Absolutely. So mindfulness-based cognitive therapy actually came from the original therapy of mindfulness-based stress reduction, which was initially developed for people with chronic pain. And so that's actually the kind of parent therapy that it's come from. And then a couple of clinicians thought, well, hang on, maybe we could use some of these same approaches to deal with psychological pain, as well as sort of bodily pain.
And I think for us sort of dealing with farmers and out on farm, that's something you can do just anywhere, isn't it? You can be in the middle of something, and then if everything's getting too much, just take yourself away for, a few minutes. And even the brief bit that the chap was speaking, you could kind of feel your body sort of reacting to it, really, couldn't you? So yeah. Perfect.
Absolutely. And it's a nice way, if you are somewhere quite remote and it's difficult to travel in, to go to groups and things, our online groups can work quite well because it's a way to connect with people who might, in some senses, might be in a similar situation, at least in terms of maybe having experienced depression in the past, who can kind of share together. And we find that these groups tend to create very often a really nice environment for people, and it feels really friendly and supportive.
Oh. Well, thank you so much. Does anyone else have any more questions for Kim while she's on with us? Again, if any questions come through later, Kim, we can put you in touch and everything.
I'm afraid I can't stay, but I if you do have any questions, do pass them on.
We will do. Thank you ever so much for your time.
Thanks very much.
All right. Thanks, Kim.
Bye.
Bye. Okay, so next to present, we have Nina Parnell. She's the head of volunteering and community support at Westbank. So if I could hand you over to Nina, please. Thank you.
Good evening, everybody. I'm going to apologise in advance. I'm having real problems with my internet here at home. It's cut out 3 times already, so hopefully we'll be able to see it through to the end of the programme. So thank you very much for inviting me along this evening. It's always a pleasure to talk about the work of Westbank. And I'd just like to take you on a tour of a little bit of what we do and to highlight some of the services which I feel might be relevant across the wider Devon community. Could I have the next slide, please? Okay, so we've been providing services in the community for the last 35 years. We promote health and well-being services. The service actually started 35 years ago by GPs in our local community in Exminster, asking patients to step forward to volunteer to support people who were lonely and isolated to befriend them, and to provide transport so that they could get to essential medical appointments. 35 years later, we're still doing very much that in the heart of our community in Exminster and surrounding communities. But in the meantime, we've also developed our services and now deliver a broad range of services right across Devon and beyond. You'll see in the slide there just a few of the things that we do, from our Neighbourhood Friends service, which won the Queen's Award for volunteering this year, which I'm very proud of, who support people who are being discharged from hospital, right through to walking groups for health, healthy cooking sessions, and we've got our own gyms both at our centre in Exminster and in Budleigh Salterton. What I really wanted to focus on this slide is that you'll see that we've got over 500 volunteers who work with us and make a difference within our community. That's actually 3 times the size of our workforce. So they're at the very heart of everything that we do, and we really couldn't deliver our services without them. So don't worry, this isn't a pitch for volunteers for Westbank, but I would like to spend just a few moments talking about the many benefits of volunteering. And it kind of feeds on from what Tim was saying earlier, and it's about giving people a purpose and a meaning in their lives that can help them to overcome all sorts of difficulties. As head of volunteering, I think something that I get an immense amount of job satisfaction from is seeing people that come to us as a volunteer, particularly with those with mental health problems, where we can support them and engage with them to help them to make a difference to the people that they are supporting, but also in return that they get so much out of it in their own lives. Mind have conducted a survey, which I'm sure that you're all very aware of, the 5 ways to well-being, and one of the 5 ways is about giving, and research into actions promoting happiness show that committing an act of kindness once a week over 6 weeks is associated with an increase in well-being, and I can tell you that we see that each and every day with a lot of our volunteers. So as I say, it's not about me pitching for volunteers for Westbank, it's about advocating for the many, many benefits of volunteering in your local community. And so it's reaching out to people that if you are struggling, you become lonely, socially isolated or whatever, there is so much on offer out there through all of the charities, through Devon and Somerset. So, you know, it's something really I would advocate for people to look into to see if that may be able to help them in their own lives. Just as a way of an example, I'd like to tell you about a young person who was referred into our services, who was just finished university, was really struggling with anxiety and depression to the point that he had actually set a date for his own suicide. One of our workers worked with him, our community link worker, and we actually got him into a volunteering programme with us, and we supported him through that. And I'm really pleased to say that from that volunteering opportunity, where he learned all sorts of new skills and gained support from our organisation, he actually got a job with us. And here we are, 2 years past to the date that he had decided he was going to take his own life, and he's still working for us. He only works part-time, and he still has difficulties, but as a team we are there to support him. So that is just one person that we have working for us in those sort of circumstances, and it, as I say, it gives me an immense amount of job satisfaction to see the difference that one volunteering opportunity has made to that young person's life. So as I say, for me, it's a passionate plea really that if people are struggling, please consider volunteering. doesn't have to be for Westbank, but for any of the wonderful organisations that are out there. And also it goes out to say to people that work for organisation that utilise the skills of volunteers, that to think about how you can support people with mental health problems. We're not a mental health charity. We are a very wide-ranging charity that support all sorts of people. But if there are ways where there's a will, there's a way, actually, and finding a way to support people that have mental health problems is a very satisfying and very needed role at the moment. So that's the bit over about volunteering. If we could go on to the next slide, please. As I've mentioned, Westbank deliver a broad range of services right across Devon. And I wanted to highlight about Devon Carers and the work of Devon Carers, because for me, unpaid carers are the unsung heroes of our recent pandemic, as all of the services supporting people with ill health, day centres, etc., closed down. The unpaid carers were there to continue caring for them and supporting them through some really difficult days. And our Devon Carer service is there across Devon, and it's there to provide information, support and training for these carers. Now, we've got a bit of a challenge going at the moment. We currently support 21,000 carers. But if I tell you that across the UK, there are something like 7 million unpaid carers, that's 1 in 10 people are an unpaid carer. So, as I say, we support 21,000, which is a massive number. But with the support of the Exeter Chiefs rugby player Tom O'Flaherty, he's supporting a new campaign that we've got where we're trying to reach 100,000 unpaid carers in Devon who are currently not receiving any support. So this is, I'm putting it out there that if you or you know of someone that is an unpaid carer, please have a look at our website and see the ways in which we may be able to support you. There's all sorts of services there, like a hospital service. They've just won an award for from the health, I can't remember exactly who it is now, it's gone out of my mind, but anyway, they've just won a national award for the service which they provide in supporting carers who have either been in hospital themselves or their cared for person has been in hospital to help them when they get home. There's all sorts of things there that they can do to support people. So please, as I say, it's a bit of a plea from me that if you know anybody who is a carer or you are indeed a carer yourself, to check out the Devon Carers website and see how we may be able to help you, and certainly to register, because that's the only way we can put forward and say how many people are out there paying this role. There's some amazing statistics around it that without carers, the NHS would actually really struggle to provide the services that they do. So please have a look at it. On to the next slide, please. Okay, so our Devon Young Carers. We work with young people aged between 4 and 18 who help to care for a family member or a friend who's struggling with an illness or through drug abuse or alcohol misuse or whatever. The teams, as it says there, they support 1,600 young carers across the county who give up part of their childhood actually to their caring roles. I mean, we hear some heart-rending stories of the sacrifices that they make and the things that they forego in order to help with their caring role. So again, it's that if you know of anybody that is carrying out a young carer's role and you feel that they could best receive some support, please do have a look at our young carers service on a website, who'll be able to give you some great advice how we could support these young people. We've got another Exeter Chiefs players helping us with this. who is helping. He's become Ollie DeVito has become a carers ambassador, and he's helping us to raise funds so that we can support young carers with bursaries to buy them the things that would help them to make such a difference in their lives, things that so many young people actually take for granted. So it's, you know, his support is really, really welcomed. On to the next slide, please. Okay, and I've put this in here from Healthier Devon. It's about a type 2 diabetes prevention programme, and you'll see there that we offer about 19 sessions to people who've been diagnosed as being at risk of type 2 diabetes. Each participant will receive support around healthy eating, mental health, physical activities, and addressing barriers. They work on a one-to-one basis or through peer support, where through either a group engagement, it encourages people to share their challenges and give an opportunity to share from each other, and it offers people a sense of giving back to their community as well, because they're helping people to overcome their challenges around their health issues. So a really great programme. People can self-refer into that, or it can be done through the GP. Available right across Devon, so please, if you or one of your family members is struggling with your type 2 diabetes, then please do have a look at the services that we can offer. And finally, on to the next slide, please. Sea Change is a service West Bank service that's actually based in Budleigh Salterton. It's the old community hospital that was closed some years ago, and we have been working with the Budleigh Salterton League of Friends and the NHS to develop quite a new and innovative service at the hospital, where we work alongside the NHS, who still deliver some outpatient services there, and then we operate alongside that by delivering a range of services that promote health and well-being to people living in.
I think we've lost you a little bit, Nina.
It's very frustrating, isn't it? So we're working on the basis that good health and happiness are closely linked, and it offers access to practical support for all generations. So if you're living in that area, there is a great facility that's on offer from West Bank there. That's really it from me now. If we could go on to the next slide, please. There we are. If anybody's got any questions, I'm very happy to take them now, or full details of what I've been talking about can be found on our website. And if you'd like any information or support around volunteering, please do give me a call. Many thanks.
Oh, thank you, Nina. Oh, it's really interesting. Sorry, my internet seemed to cut out then rather than anyone else's. But does anyone have any questions for Nina? Nina, I was just wondering, because I can see you got a really good website for West Bank, and obviously you've run a fair few awards over the times as well, like you were saying, which is fantastic. And just looking at the website, looks really easy to use. So thinking when perhaps for us as training standards officers visiting vulnerable scams victims, it looks like a website that's really easy to use and just to sit down. And I noticed you can type in just a month, an area in Devon, and you can easily see what activities are going on. So,
Yeah.
So that's certainly something that we can, push out to our officers going out on visits, to vulnerable people. So,
very happy to work with you in any way that we can.
Lovely, thanks, Nina. And again, is there something similar for Somerset area?
Oh, I'm sure there will be. I don't know off the top of my head, I'm afraid, but I'm very happy to research that, and I'll drop you an email so that you can share. But there are a number of organisations, I feel sure, in Somerset that offer similar support.
Yeah. Well, that's great. Thank you very much, Nina. If no one's got any questions, again, if any come along afterwards, we will forward them on to you, Nina.
Okay, thank you very much, and thank you for inviting me. It's a pleasure.
You're very welcome. Thank you. Okay, so next we have Holly Beckett joining us from Focus Farmers. Holly will also be talking about the Addington Fund, sort of last up as well. So talking about Focus Farmers and learning how to develop more focus in your daily life, be less distracted and achieve your goals with a clear state of mind, which I think definitely we can relate to as busy officers. So I'll hand you over to Holly. Thank you.
Thank you. Yeah, you've got double trouble, and it's worked out quite nicely actually, because following Kim's presentation, I am a huge fan of mindfulness, and mindfulness. I think the NHS service and the functions that they provide there are, she said, for people with depression or emerging from depression, but mindfulness is for everybody. I just wanted to start my presentation setting a challenge, and hopefully everybody is actively listening. And what is active listening? Well, most of the time, quite often, when we're listening to someone else, we're not just solely listening to what they're saying. We're also listening to the chitter chatter that's going on in our head a lot of the time. Very, very normal. Becomes an issue perhaps when we get engrossed in that. And how many of you can recall a time where you've been having a conversation with someone and suddenly you realise that you've got lost in your own trail of thought, having some adventure or worry, and then you're sort of back in the room and you didn't hear actually what they said. But do we say, oh, I'm sorry, I've got distracted, can you repeat that? Most of us probably just nod and smile and hope that we can get back into the conversation, which kind of generally works, except when we've missed that key thing that somebody has said to us. Anyhow, the challenge is actively listening. So you'll notice these thoughts and the mind chatter is going on in your head, but you don't have to engage in it. You don't have to engage in the thought. You can just notice, bring your attention back to listening. So if you pop to the next slide. So I run a program called Focused Farmers. It'd be good to see actually who's actually farming, although it's not just for farmers, it's anybody really in the agricultural community. If you just want to, put a hand up, give a thumbs up, it would be great to see how many of the group are working in agriculture. Great. So Focus Farmers, why do I like mindfulness so much? Because it is great to increase your focus. And what's the enemy of focus? Largely stress. Is all stress bad? Well, not really. It was kind of designed to save our life often. If we have to react to man-eating tiger years ago jumping out the bushes at us or something like that, it was a pretty good and efficient system for keeping us alive, because we'd either go into fight mode or flight mode or freeze mode. But I'm not sure there's many of those people around because they'd have probably got eaten. So what happens when we get stressed? Our heart rate increases and our blood pressure increases, and a fatty residue comes along our arteries, basically so the blood can pump round our body quicker, so we could either fight this man-eating tiger or woman-eating tiger or run away. We wouldn't need to, our body wouldn't need to be putting energy into our digestive system to be able to either fight or run for our life. So digestive system reduces, and it wouldn't at that time also be putting energy into our immune system functioning properly, so it reduces our immunity. We get increased cortisol production. So cortisol is this chemical, this sort of stress hormone, which is really important for lots of functions of the body, but too much of it is aging, and it's not great for our overall health. And of course, you probably all know what happens from your own stressful times at life, what happens in the bedroom, and it also weakens our bone density. So stress is, although we may be able to handle it, it's not great. That certainly these high levels of continual stress. And if you flick to the next slide, what gets talked about less with stress, I find, is actually what happens in your brain. And what you can see on the screen here is the neural networks in our brain. So it's where all the information's traveling down these millions and millions of miles of neural networks. So when we get stressed, they actually shrink. You can see on my right hand side, hopefully it's the same for all of you. I always get confused because it gets reversed. That they're actually shrinking down. Why is this? Because if we were fighting or running for our life, we don't need to think logically. We don't need to think strategically. We don't need to think clearly. We wouldn't actually have to think that rationally. In fact, we might not be thinking at all, which is why we often, in these high levels of stress times, get this kind of brain fog, and we haven't really got the clarity of thought that we have when we're at our best. If you pop to the next slide. However, there is good news, because stress begins in your mind. And because it begins in your mind, you can do something about it. And Kim again touched on this idea of how our thoughts are connected to our emotions. So we have a thought and an emotion will arise, and our brain is like a supercomputer. It has held on to everything that we have ever done and seen in our life. Our conscious mind, this sort of bit that we're aware of, you're not going to recall every memory and moment, because that would be really busy mind, but it is all there. So when we're having any experience in life, because these are also, we could have an emotion and that makes us think something, we then have a physiological response to it. So our body reacts with producing certain chemicals, and that in turn affects our behavior. So if our thoughts are positive and happy, there's this more feeling of a positive state of mind. It produces the serotonin, those kind of happy chemicals. And what do? We're a bit lighter, we smile, we're listening to people, we're more open to doing things for them. Conversely to that, of course, when we start to think negatively, that brings our emotional state down. The more negative chemicals will start to increase in our body, like that cortisol. And what happens to our behavior? We perhaps come slumped over. We're not really paying attention to what's going on around us. We're often wrapped up in what is going on in our head. And this is all very normal. We're wired to do it. And a long time ago, when there was not so much going on, it was probably quite helpful. But today's, 21st century, especially with phones, laptops, pings and dings from everywhere, we're trying to look after the kids and run our day jobs and support our friends and go to the latest training that we want to do, and it can become a bit too much. And what worse that we do with our mental energy is we don't spend time in the present moment, in this moment right now. We are somewhere in the past thinking about something that has happened and been and gone. And if it's perhaps that argument that you had and you're running over, well, I should have said this and I should have said that. And to me, I don't think that's particularly effective, because you can't change it. It's done. And also what happens is we make these connections to those scenarios. So if you've had a bad experience and you're thinking back on it, those same emotions are going to arise. This unconscious mind that you have, which runs quite a large part of your life, cannot tell the difference between the past, the present and the future. And of course, so if you're thinking back on things that have happened in the past, on the most extreme level there, we can become quite depressed or experience PTSD. Alternatively, with somewhere in the future and we're thinking about things that haven't happened yet and might not happen, and we are designed often to think negatively about those things as well. So if we're experiencing something that's quite uncomfortable, whether it's happened or not, those emotions are going to arise in our body. And again, on the extreme level, on that side, that's what can cause these feelings of anxiety. Next, please. Oh, that was just to say, yeah, sorry, emotions and thoughts linked both ways. Thank you. So Focus Farmers, I started it in 2017, and it was a pilot to introduce mindfulness to agriculture and to the farming community. So I started off with 30 farmers and agricultural workers, mixed male and female, probably 80% male, 20% female. And we had people from dairy sector, sheep farmers, pig farmers. We had a farm secretaries, vet, and another couple of sort of industry workers. And I work with a psychologist called Willie Horton, and we devised a 12-part mini-series, which I'm trying to kind of give you some of the key points here, but obviously to really understand what's going on in our mind, understand how our personality develops, understand some sort of more of these psychological concepts. It takes a bit of time, but it's a 12-part mini-series. And there was also some coaching involved, and effectively the farmers were given an exercise to do each day, which just took a few minutes. And these were the results. So self-discipline increased by 25%, a purposeful focus increased by 20%, a positive state of mind increased by 24%. Flow increased by 10%. And if people haven't heard this term flow, it's those moments that you have where you're doing just what you need to do when you need to do it to get the job done. All those kind of cares, worries, thoughts fly out the window. And sometimes you can get quite long periods of that, you know, when you're kind of like riding the crest of the wave. And stress reduced by 20%. And as I say, stress really is the enemy of focus. So the more that we can keep it under control, and that we all get stressed and periods of stress, but the key really is to make sure that we can notice it and bring ourselves down, press the reset button. And that way we're not going to kind of increase to the point of boiling over. Next slide, please. So what is mindfulness? Well, the University of Massachusetts Medical School defines it as consciously paying non-judgmental attention in a very deliberate manner to the present moment. Now, if you're like me, you may have just heard or read that and thought, what on earth does that mean? And it does take a little bit of getting your head around, but consciously, you know, there's a lot of things that we're doing unconsciously each day. In fact, university studies have shown that the average person is present for only 1% of the time. So consciously paying non-judgmental attention, and that is difficult. We judge everything, but in a very deliberate manner and very much by our senses. So what we can actually see, feel, hear, taste and touch in the present moment, in this now. As I say, trying to combat a little bit being somewhere in the past or somewhere in the present, and just enjoying this moment, giving what you have in front of you your full attention. Next, please. Go to the next slide. Thank you. So at the core of, well, the scientifically proven way to increase your mindfulness, this ability to just be present, is through mental exercise, and it's very simple brain training. Again, if people in moving forward, if they want to give it a go, just give me a little thumbs up and we'll see what out of 25-30 people response we get. So thumbs up if you actually want to give this a go. Simple brain training. Okay, we choose something like the breath. You only choose the breath because it's always there and in any moment, and it's free. Farmers like that. So you choose something to focus your attention on, like the breath. Your mind is going to wander, it's going to chatter, you're going to get distracted from what you're doing. The idea is that you notice, you just let the thought go, you don't have to engage, you refocus your attention, and again, you bring it back to the breath. You're going to get distracted, you refocus, and you bring it back to the breath. And it's pretty much mental, it's like taking your mind to the gym. It's a bicep curl for the mind. So people who've perhaps tried this exercise before and said, well, no, I can't concentrate, I can't focus. That's the point. And the bit that builds the muscles in our brain and makes the difference is the fact that we get distracted, but we notice, and we don't get upset about it, and we don't get frustrated about it. We don't judge it. We're non-judgmental about it. We just refocus and move back again. And as Kim has already said, if you just click the next button, this is effectively meditation. People have been doing it for thousands of years, actually, but mindfulness has sort of brought it to the West. And now there is tons of science to show how beneficial this is for us and how effective it is in protecting our mental health. So we all have mental health, and the more that we can do when we're in a good state of mental health, to protect ourselves from kind of moving down into that poorer state, the better. Next slide, please. So as I said, there's absolutely tons of science to show how beneficial and effective meditation and mindfulness is for us. And neuroplasticity is what really discovered this. So when I was at school, I learned that by the time we got to 20, our brain was fully developed, and it was kind of downhill from there. And it was really quite depressing. And they got that wrong. Actually, our brain continues to develop. I mean, we're really in state of adolescence until we're in our late 20s. And then our brain will continue to develop as long as we're doing new things. So that old adage of use it or lose it is definitely true. And the way that medical researchers came across this actually was that children who had had brain trauma, brain injuries, who were thought to not walk or talk, later on in life, actually made a full recovery. And when they looked at the brains of these children, those areas were still damaged, but what happened was the brain had rewired itself around those damaged areas, and that led to this whole study of neuroplasticity, to realize that our brain got a plasticity nature and changes all the time, especially in regards to what we're thinking that is affecting our brain. But on this picture, what we can see is the frontal lobes is here, and this red area is what we know as our grey matter in our prefrontal cortex. So really important for memory and concentration and creativity. And you can see on the meditation side that red area is actually increased and develops in size. So like I say, doing this meditation exercise, this mental training, is actually doing like a bicep curl for the mind. And interestingly, actually, there's the same studies that prayer brings these same changes to the brain. If I can have the next slide, please. So benefits of regular meditation: it reduces stress, as you saw from the study, and have gone on, and dozens of farmers have produced the same, very similar results. And we're not talking about having to do years to gain those changes in the brain either. That's just after 8 to 12 weeks of regular meditation. I'd love to say daily, but I know that they're not doing it daily. Habits take time to form, new habits, but we keep going at it. So reduces stress, it strengthens our memory, it improves our concentration, our focus. It increases productivity, because when you can start to banish the pointless thoughts that we have, a lot of them are just, they serve us no purpose. When you can start to say, what is this, is this useful to me, this thought, this time? And if it's not, just let it go. It creates so much more space for you to think about what you want to think about. It develops our emotional intelligence, which is great for communication. So our self-awareness and self-management, and our social awareness and social management. It actually reverses aging. So there's these little things called telomeres in our cells, and they're like a little time clock of our body. And meditation has been actually shown to lengthen these. They reduce over time, which is what is correlated with aging, and these actually start to lengthen. It promotes better sleep, and that is like great for everybody, because obviously if we are not sleeping well, that has such a knock-on effect to our day. And it enables more creativity and innovation. And if you just click again, ultimately it boosts these periods of flow where we're getting what we need to do done just when we need to do it, without a care or worry. And again, it enhances our leadership skills. And this all came from, I did a Nuffield scholarship back in 2015, and one of the key points I realized during that time is that leadership training is for everybody, because in some way, we're all a leader, even if it is just of our own life. And the next slide. So just to say that Focus Farmers has kind of got a dual thing. It's around mindfulness coupled with goal setting. And I think these two things are important. Like, where is your focus? Where are you putting your energy? Is it in the right direction? Is it where you want to go? And what is your purpose? And again, if you click, I think it's really important for us to discover knowing your why. And why are we doing anything that we do? And if you don't know why you're doing something in any moment, I would say that you perhaps shouldn't be doing it. Next slide, please. Right, so we're down to, I don't know how we're doing for time, so I'll leave it to the organisers, and they saw how many people wanted to do a short exercise or not. So we could do maybe 3 or 4 minutes, but I'm quite happy that if you don't, there's some exercises on the Focus Farmers website, and there is that free video series that you can download. And I run a number of different sort of workshops and focus groups. We'll have WhatsApp so that people who are getting into regular daily mental exercise or trying can kind of check in and just sort of regulate each other and keep each other accountable for that. So please do visit the website to find out more, and you can always ask me any questions as well.
Oh, that was brilliant, Holly. That was really fascinating. Thank you, Holly. And I know you've said about the exercise, but I think we've got, well, obviously yourself, we've got to ask you to speak again. And we've also got Nikki from the Samaritans. But I think just listening to you, I think many colleagues, I think definitely other organisations, obviously not just farmers, can really recognise the benefits in this. And when you were saying, you know, I'd already jotted down for myself, you know, like forgetfulness, my concentration. And if you just, when you've got about 10 million jobs to do and you just actually need to focus on the one, and you have those days when you sit there and you don't end up doing anything because you're, and so
overwhelmed.
Yeah, overwhelmed. And such as sort of setting up webinars, this sort of thing, you know, it's very, you know, so I can just see the time it would free up. And I was just wondering, I think it would be really great to have you sort of come and chat to some of us at some point, if that would be okay. You can just
Great.
That. I was also wondering if you had any plans to take this out sort of face-to-face, perhaps markets, because I know obviously farmers are very difficult to kind of get to, you know, integrate with you and everything. So whether we could look at, you know, with our sort of offering our free pasties and a coffee and a meditation session, you know, such as at the Devon County when they had their haircut as well with the barbers and the chat. I think, you know, that's possibly something to look at, maybe with markets or something.
Yeah, that would be great. And I'm obviously often at those shows because my other job is with conference.
Absolutely. But no, that was really fascinating. I think we would definitely come back to you to see if you could give any sort of hints and training to us actually as officers. So did anyone else have any questions for Holly? Again, if anything comes through, I will obviously let you know. We'll let you take a breather, Holly, and prepare for your next bit. But if and then we would just move on to, so our next talk is from Nikki Mugford of the Samaritans. We're lucky to have Nikki with us tonight. She's the campaign manager, and talking about the current campaign, which is Real People, Real Stories. Thank you, Nikki.
Thank you, and hello everyone. So yes, tonight it would be great to talk a bit about the campaign called Real People, Real Stories, which is launching on the 1st of March next year. I thought it might be useful, if you come on to the next slide, please, just to quickly do an overview of Samaritans. Some of you will know a lot about Samaritans, some very little. So a quick context slide on Samaritans, a bit about the background of Real People, Real Stories. It's been running a while now. The plan for the campaign next year, any questions and feedback, and next steps. So if we go on to the next slide, please. Samaritan's vision is that fewer people die by suicide. Next slide, please. Obviously, we're a really important charity, and we've been around for many, many years. Some interesting stats here. Probably you'll know this, but suicide is the biggest killer of men under 50 and young people aged 16 to 24. And that latter is an emerging trend, which is not good. In the UK in 2018, there were 6,859 suicides, and 3 out of 4 are men. Next slide, please. This just gives an overview of Samaritans and our service at a glance. The stats are amazing in terms of how many people we help each year and each day, in fact. So just a few snippets here. We get 10,000 calls every day. We've got 201 branches all over the UK. We've got 20,000 volunteers, and we're recruiting the whole time, and the demand for our service is increasing. It's a free service, it's non-judgmental, confidential, and it's available 24/7 every day of the year. Fantastic service, and we know from what people tell us that after they've contacted us, their distress is much reduced, and we spend 1 million hours a year responding to calls, so it's huge. We're all over the UK, and we're doing some fantastic work, and increasingly so. I can tell you a bit about what else we do on the next few slides. If you carry on, please. Thank you. So if we just take a look at why people are calling us, 1 in 5 calls for help were about worries linked to the coronavirus. This is 2020, by the way, so that's quite an obvious stat. 1 in 4 calls for help were about suicidal thoughts or feelings, and 1 in 12 for help were focused around self-harm. And then there's some caller quotes there. So I think the point is that we're moving, well, we have been moving from sort of, crisis perception to just call Samaritans when you're struggling to cope, when you're finding life tough. So that's very much our positioning, and the campaign that I'm going to talk about is exactly that. If you're finding life tough, then seek help at an early stage, and think about calling Samaritans, or seeking other help, whether that's family, friends, GP. So it's very much seeking help and preventing people from reaching crisis point. But obviously we're there for people at crisis as well. Next slide, please. So yes, just reiterating that point about we're there to prevent the crisis, and we do that through many ways. So we've got a really strong research team within Samaritans, and so all of our campaigns and activity is based on solid research and understanding what the causes of suicide are, and understanding the risk factors, and ensuring that we understand those and provide the right support with the right evidence to influence policy, for example, to run campaigns. All of our training, we do lots of training in the rail industry and in the workplace, and again, that's all based on years of research. We've got digital tools, we've got apps, and we work in partnership with many key sectors and groups of people to help reduce suicide and also post prevention support. Okay, next slide, please. We work in collaboration with many organisations and many media organisation as well, to raise awareness and encourage people to seek help. Recently, we worked on a project called Our Front Line, which was a collaboration with Mind and various hospices, and that was providing support to frontline staff, and we had a dedicated helpline actually, and lots of materials to help frontline. And then we worked recently. We helped the Lord Mayor's appeal as well, and that's been really successful. Alongside that, we've got lots of partnerships with corporates, including Network Rail, which has been successful over many years, with 3 Communications, with Barclays. So yes, it's Samaritans is, you know, the stigma is reducing, thankfully. And we've now got the opportunity to help more people through these partnerships, these excellent partnerships that we're getting. The next slide, please. So on to the campaign, Real People, Real Stories. It's a campaign that is targeting men. It's been running for 2 years now, and it's encouraging men to share their stories of how they've overcome tough times, and encouraging others to seek help by calling Samaritans. So we know from research that people telling their stories of coming through tough times, getting through tough times, and the hopeful stories, we know really helps other people, which is why we launched this campaign. So again, as I mentioned, it's really important. We try to encourage men to seek help early on and not leave it till too late. The next phase, as I said, is on the 1st of March. The next phase is, the next slide please, is actually will actually be targeting men in rural communities, which I'll talk about in a minute. But the campaign creative will be the same this year. We'll have new case studies of men from rural communities talking about their experiences, and then they'll share their key message to other men. So an example here, you've got John and Matt, who featured in the campaign last year. They were filmed talking about their struggles and how they overcame them, and then we asked them to say something that they would want to say to other men in a similar situation. So they were handwritten words, very simple but very powerful, and that campaign went across kind of a media, and we went on Talk Sport Radio, we're on BT Sport TV, and we had posters up in and outside the rail environment. So we got some great coverage of that campaign, which is why we're running it again. If you carry on, please. Yeah, as I say, some great research results here with YouGov. Once men had seen the campaign, they're much more likely to seek help, so 27 to 32%. And many men said that as a result of seeing it, they would recommend a friend or relative to contact Samaritans. So that's a really positive response. Next slide, please. And then we know that men who experience symptoms of insomnia have a higher level of struggles and suicidal thoughts. So when we did the campaign, we targeted men at night time. So we bought media in the nighttime and early morning slots. And again, there was a really good increase from 2019 to 2020 in terms of men who had seen the campaign. So we were effective in reaching those men that were struggling to sleep. The next slide, please. It's been award-winning. We've won a few campaigns, which have been brilliant. And the best one was the Grand Prix Best Overall Campaign in the Campaign Media Awards. And that was amazing because we beat some big brands, like my favourite brand, Guinness. So very pleased about that. So it's been recognised as a successful and effective brand campaign, which is great. And next slide, please. We are lucky enough to have some funding from the NFU Mutual Charitable Trust, and that enabled us to do a really small test campaign last year to reach men in rural communities, and we had some success for that. We had 333 bus panels going in rural communities. We did some social media targeting men, and we did some trade press, and NFU Mutual had some a really good outreach with their media channels, reaching over 33,000. So we did a bit of a test last year, and that worked, and then NFU Mutual Trust were really pleased with it. So they have given us a bit more money to do another campaign in March, which is absolutely brilliant. So the next campaign will actually feature men in from rural communities. If you carry on, actually, please. Aside from NFU Mutual, we also have, again, a small pot of money from the Scottish Government purely to do West Highlands and the Isle of Skye. And we're desperately trying to find a case study in the West Highlands and the Isle of Skye. So if anyone knows anyone up there, then please let me know, because we need to film them in the next few weeks, ideally, well, before the end of January. So again, the campaign is similar to previous in terms of encouraging help-seeking behaviour to those hard to reach men. They could be farmers or they could be lone workers in any field, but obviously they're likely to be in the agricultural sector, I would imagine. We're going to build on the media channels we selected previously, the ones that worked. But we're exploring other opportunities to reach this audience, and obviously any help from you in terms of some ideas would be fantastic. And it's all about collaboration and working with organisations and people like you to get the campaign out there to reach this audience. And I know there's some fantastic other organisations around that are doing brilliant work. So I think as collaboration is key. Next slide, please. The issues of rural communities, I know you know all of this, but this is kind of the reason why we want to do it. Samaritans want to do this because these are all the triggers to suicide, the loneliness, the isolation, the deprivation, the access to support is limited, and services. So yeah, that's the rationale that we want to do more with this community. It's a really important community. And the next one, please. We understand that rural communities have a greater propensity for suicide than any other area. It's always, obviously, suicide is always kind of multiple reasons and it's complex. And we do know that the ONS say that skilled trades occupations, agriculture and related trades, have the second highest risk of suicide, 1.7 times higher than the national average. People working in the low skilled roles such as harvesting crops and animal rear are twice the national average. There's an easier access to the means of suicide. In terms of women, the proportion of women working within agricultural roles tends to be lower, but that's changing. Smaller numbers and suicides make the data less reliable. We obviously would like to reach out to women as well. But as I say, the focus is on men because they are higher risk and we have sort of limited budget and funds. But there's the campaign hopefully will grab media attention, which will be seen by women, and the posters and some of the collateral is quite gender neutral because they're just written words. So it's not excluding women per se, which I think is good. Next slide, please. As I say, just to recap, the target audience is 18 to 60, living in rural communities, England, Scotland, Wales and Ireland, at crisis point, have attempted suicide or had suicidal thoughts, are struggling to cope with one of the following. So it could be job loss, debt, homelessness, isolation, relationship breakdown, alcohol, gambling. And we are also interested in younger men. So they could be the young farmers as well. As I say, that's an emerging and dangerous trend that we're seeing.
Okay, can everyone else hear Nikki? Is it just me that's got internet problems again, I think?
No, I can't hear her either, Becky. I've got she's gone.
Oh, Nikki, you seem to have frozen. I don't know if I don't know whether you're able to come out and come back in again. I don't know if you can hear me. Bear with us, everyone. That's it. I think Nikki's going out. She's going to come back in again, so hopefully that will be okay. There must be something in the air tonight, I think.
If she struggles, we could always ask Holly if she doesn't mind starting the Addington Fund.
I just really wanted to have a little rundown, so I'm more than happy to do that.
Yeah, if you're all right, then we'll try and get back in touch with Nikki, Holly. Holly was back with us, kindly talking on behalf of the Addington Fund this time, which is obviously a fund that helps farming families in sort of desperate times of need. So pass over to you for a moment. Thanks, Holly.
Thank you. So again, I think there was quite a few that were part of the working as farmers or in the agricultural community. So this is just a little bit of awareness raising, so you know that we're there and you can please tell others that we're there. But we just celebrated our 20th year anniversary. So the fund was originally set up when classical swine fever hit in Suffolk. And then they were also responsible for delivering £10 million of funds when foot and mouth affected everybody so horrendously. And from there, we've developed into providing sort of 5 key areas of support for farming. So we still provide disaster relief in times of if there's severe weather or outbreaks of disease. And we will also support people who are really struggling, especially if you've got livestock. We provide support in terms of feed or fencing and things like that. And then really the sort of other direction that Addington Fund took was in housing. So we provide retirement homes for farmers who especially tends to be tenant farmer. So if they're struck by illness or something has happened where they're having to leave the farm, and we will be able to step in and assist them in doing that. And we have a number of properties where we have equity share with farmers, retired farmers, or provide affordable rents. And we do see that this support is probably going to increase as well over the next few years with everything that's happening with the agricultural reform, and especially with that exit strategy that's still nowhere really near being finalised. I don't think. We're all just waiting and seeing, but there is opportunity there for support. Shall I just carry on, or shall I hand back to Nikki?
Hi, Nikki. Nice to have you back.
Sorry,
no,
I don't know what happened there.
I'll come back in a bit. I'll let Nikki carry on.
Are you sure, Holly? Is that okay?
Yeah, if you can flick back to her.
Thanks. Sorry, guys.
Hi. Thank you both.
Okay. So in terms of how we're reaching men in rural communities, these are just some ideas. We're talking with our sort of experts in terms of how best to reach these men. The mix we had before, we had a bit of radio, we had online targeting, we had social media, We had bus panels inside buses and local press and adverts and advertorials. And then the NFU Mutual helped us. Oh, here we go. I'm still here.
No, you're back.
Next slide, please.
You're back.
We've also got our own channels, and as I mentioned, we've got 200 branches. Many of those are in rural communities, and they've got some links with some great organisations in their areas, and then obviously we can encourage them to get our promotional materials in local kind of pub stations and shops in those communities. We've got our website, and we've got a press team who will be reaching out to some of the regional and local press, and we'll be collaborating with organisations and people like you. So we'll be drawing up a list of organisations that we can potentially send a toolkit to prior to launch in February. I would be really grateful for you to share those kind of assets and retweet the campaign, etc. Yeah, so next slide, please. As I mentioned, we've so far got 2 case studies. One is Michael. We filmed him at the Yorkshire Agricultural Show actually in the summer. And he is, he's just absolutely fantastic guy, and he's in the agricultural world as a rural pest control business owner, and it took him a long time to sort of get through his struggles, and he had suicidal thoughts, and unfortunately he's got through it and willing to talk about his experience really candidly. So it's a really, really powerful story, it's great that he's agreed to help with this campaign. We're just finalising the film actually at the moment, and we have various sort of versions of it in terms of length of versions to go across social media on our website. He's happy to speak to sort of local press and radio as well about his experiences. So the next slide, please. And also we have another case study, Sam, who's a bit younger. He's actually a farmer in Yorkshire, and his family was in farming, and he just talks about the pressures of the family and relationships, and the money struggles. So he had lots of issues, and he was really struggling at a young age, particularly in his 20s. And he got to the point, fortunately, where he did speak and seek help from, it was actually his family. But his story is really, really powerful as well, and he talks about the importance of talking and seeking help, and encouraging other men in his situation to seek help, and call Samaritans or seek help with family or friends. So another really, really powerful case study. And we are, as I say, we're trying to find one in Wales and one in the West Highlands in the island of Skye to film in the next month, ideally. Next slide, please.
Sorry, Nikki, I just wondered if I could interrupt you there, because we did have a question from Robin with you saying about looking to film. If somebody knows of people who make a good case study, how would we point them in your direction? Could come through us or come straight to yourself?
It'd be great to come direct to me, and then I've got a lady helping me who is liaising with the case studies. So in the first instance, then me, I'm happy for anyone to come to me. But thank you for offering to support on that, because it's always really difficult to get men to speak out. So brilliant, thank you.
And that's Wales and the West Highland you're looking for?
Yeah.
I mean, Robin, if you wanted to sort of get in touch with us, then we can give you Nikki's details, if that's okay.
Yeah, I have got a slide at the end that's got my details.
Brilliant.
But yeah, either way, it doesn't matter. Thank you, Robin. In terms of measuring success, obviously, but the funders are keen to understand if their funding has worked and it's done the job that we want it to do in terms of raising awareness of Samaritans and our services, encouraging men to seek help. So obviously the propensity to act, we would love to, we do measure that as a result of seeing the campaign, and engagement to make sure that actually the creative that we're using and the messaging in the campaign resonates with this audience, to achieve all those goals. So yeah, we'll have an evaluation and measurement plan in place for this campaign. And next slide, please. So yes, this is for discussion actually with you. We're going to be working with the industry sector to spread the word, and we will be producing a toolkit with assets that will be campaign assets that will be available, and we're hoping to have a sort of template of a press release. So we'll hopefully make it easy for people to get involved and spread the word to amplify the campaign. And next slide, please. Any further questions or feedback at all?
So I don't know if anyone else has got any questions for Nikki. Robin also asked, you got funding from the NFU Trust. Have you applied to the CLA Charitable Trust for funding?
No, I haven't, but I'm going to write that down now as a possible.
Do you have any contacts, Robin, while you're on messaging that we could pass on to Nikki?
Okay, fab.
So I'm sure you two can.
No, that's great. I can, if you just go to the next slide, I can just give my details. So just maybe Nikki, I can work with you in terms of sort of names and organisations of emails that I can, keep in touch with progress on the campaign. And yes, as I say, we'll have a toolkit. And we'll obviously share an update on how the campaign went. Hopefully I can come on another of these webinars. So yeah, my email address is there, n.mugford@samaritans.org. So please feel free to contact me with anything. But thanks everyone for listening, and thanks in advance for sharing any ideas, and in advance for helping to promote this campaign to the rural communities.
Oh, thank you, Nikki. That's been brilliant. I mean, we'd love to promote anything you're doing. Certainly, because also, I think it's relevant. Not only do we go out and we see farmers on a day-to-day basis, but also we're here for colleagues, other organisations. I know that support us. If we've had a particularly bad day or bad visit, they will support us, and I think collaboration is the key. And I know we were looking at there's a current campaign, I know it's an American campaign, but Not One More Vet campaign about suicide in the professions such as the veterinary industry. Obviously we work very closely with vets, obviously the farmers industry, so that's an area we would really like to get involved in with the large animal vets and the pressures. Like you were saying about the prevention of suicide and the causes, what's the causes for it? So yeah, we would love to obviously have you on board and do whatever we can do to promote in the toolkits we can get out for you. Obviously Samaritans is a big organisation with our little sort of group that we're doing. We can do what we can to try and pass it on to others. So although Samaritans is big, we're absolutely dependent on people like you who have got the local knowledge of those communities and can reach them, because it's no point in doing
sort of, you know, wasted advertising and promotion if it's not reaching the right people. So yeah, thank you.
Oh. No, well, that was it. Does anyone else have any questions for Nikki?
I just noticed in the chat, Becky, that Holly had mentioned about getting in touch with the RSABI as well. Holly, you might be able to explain who they are a bit better.
Yeah, that's the Royal Agricultural Benevolent Institute, but it's the Scottish version. That they're a sort of sister organisation. So RSABI.
Oh, perfect.
Okay, thank you. Thanks very much.
And also as local authorities, obviously we work very closely with, you know, our neighbouring local authorities, so Wales, Scotland, etc. So I think it's just a really good connection to have, that I'm sure, you know, we've all got our own colleagues that we speak to in other local authorities and cases that we're dealing with. So I just think it's a really good connection to have. I think that we can put you in touch with people. So
yeah, brilliant. So I'll maybe catch up with you, Nikki, in another couple of weeks, or in early January. That'd be good. Thank you.
Thanks, Nikki.
Thank you, Nikki. Yeah, so just back to Holly. Just to carry on with the Addington Fund, Holly.
Okay, great, thank you. And I promise I will be only a few minutes, as I say.
No worries.
So hopefully, yeah, either this might be helpful to you or to somebody you know. So retirement homes, largely for tenant farmers, and as I say, we see that sort of increasing, and also affordable rents. So you folks in Devon, I'm sure, are more than aware of increasing house prices and the pressure that that's putting on agricultural workers to be able to live near the places they're working, and for farmers and farm businesses to be able to find workers that, you know, have a place to live close by is a bit of a strain. So we provide affordable rents in those rural housing, and those projects are developing all the time. We also have a farm worker grant fund. So this is for farm workers and their family members, and it will provide white goods and household goods for those who are particularly struggling. So especially for the sort of more low income families. And then we have a young entrants scheme. We're very blessed really to be left legacies of people's farm and land, and so we're really trying to tie that in with bringing new and young talent into agriculture. So that's kind of a newest development of ours that we're just sort of launching now. How can you help? Well, please do go and visit the website addingtonfund.org.uk, and we've just launched a really gorgeous range of Christmas cards. So if that's still on your to-do list, please go and check those out, because obviously the sales of those support the things that we do and add to those funds. But people also run breakfasts and different family events on their farm, coffee mornings and dinner dances, and choose us as their chosen charity, which is always so appreciated. And if anything, again, just really supporting us by telling other people about the Addington Fund, and to go and check us out, and please point people in our direction. That's me. I was just reading that question.
Oh wow, yeah, me too. Oh god, that was quicker than I thought. That was
That's DEFRA funding package of support. We'd love to get DEFRA funding for a package of support. We'd really like to set up a retirement group, actually. You know, I think for farmers, retiring is can be a pretty scary thing, and I really think that there's massive scope to bring those people together and to be able to support each other. We've heard a lot about that tonight, and we know how effective that is. So any links with DEFRA, please put in a good word.
Okay. Also looking at disaster relief. Oh, I'm just reading that as well.
I was nodding quietly.
Yeah. Oh well, excellent. So Robin can raise it for you. So, but this is what these webinars are really all about, you know, getting people in touch with people that you don't know maybe are out there and everything, and putting faces to names. So, because I just think about, especially with Somerset, with the disaster relief, you know, with the flooding that we had and everything, was Addington Fund kind of, would they be involved with sort of, you know, I suppose acts of God, aren't they, with like flooding and everything?
Yeah, we provided quite a lot of support, I believe. I've only been with Addington for a few months, but I believe there was quite a lot of support for that, natural disaster. Yeah.
And I think particularly you've touched on, and I know in previous sessions we've touched on succession planning, so that would tie in nicely with the retirement homes, you know, who's going to take over, where's people going to go. And I know personally, but a few of us are finding, you know, we're getting a lot more calls to perhaps elderly gentlemen on their own in caravans on a farm, perhaps where they've sold up a lot of their land to keep going, sadly. So that's another area where we do have perhaps people living in, you know, poor environments, you know, caravans, etc. So is that something that we could maybe approach you about? Or
yeah, absolutely, and please do. And actually we do a lot of work in the southwest, so we're sort of familiar with that area. But yeah, exactly, it's exactly that. A lot of people just don't know we're here, but please do get in touch, and if we can help, we can.
Okay. Oh no, that's really good to know. Certainly for, I know a few of us on the call tonight, certainly. Does anyone else have any more questions for Holly?
I think they're desperate to go and check out addingtonfund.org.uk.
So I think definitely. Absolutely. Well, I've been Googling everything as we go, so I've got it all lined up for tomorrow to present to everyone else. So I just thank you very much, Holly. We just want to say thank you very much to all of our speakers tonight. It's been really, we've learnt so much, and I think this is what this is all about, you know, just putting everyone in touch with each other. Yeah, so we just want to say thank you very much for attending, from Nikki, Sam, Joe and I and Chris. If you've got any other questions, I'm sure our emails are everywhere, that you just get in contact with one of us, and we can pass you on to the speakers, vice versa. But, you know, anyone, I'm sure we'll do another one of these, so anyone that would like to give a chat, you're very welcome. Just get in touch with one of us. But thank you very much, everyone.